Nigeria has recorded 30 new cases of COVID-19, bringing to 373 the total number of confirmed cases in the country.
All right, giving a breakdown yesterday, NCDC said 25 of the new cases were recorded in Lagos, 2 in FCT, and 1 in Kano, Akwa Ibom, and Edo states. According to the NCDC, 99 patients have been discharged while 11 have died. A breakdown of the total figures show that Lagos has 214 cases, FCT 58, Osun 20, Edo 15, Oyo 11, Ogun 9, Bauchi and Kaduna 6 each, Akwa Ibom 6, Katsina 5, Kwara 4, Kano 4, Ondo and Delta 3 each, Enugu and Ekiti and Rivers 2 each, while Benue, Niger and Anambra have 1. However, NCDC has projected that the testing capacity will soon ramp up to 4,000 tests per day, with over 9,000 contacts traced.
Very well said, Rufai. In the light of these new developments, maximizing the extended 14-day lockdown by the federal government of Nigeria is very essential, especially for Nigerian nursing mothers and their babies who will be staying at home.
And joining us this morning to share tips on how nursing mothers can navigate the lockdown in taking care of the newborns amid COVID-19 is Dr. Uchechi Ogundele, US-trained pediatric nutritionist and author of A Mother's Guide to Understanding Her Newborn. Thank you so much, Dr. Ogundele, for joining us this morning and making out time to come to our off-site studio here in Lagos. The babies keep coming. In Lagos, yesterday, Governor Babajide Sanwo-Olu announced that the state has recorded over 600 childbirths in the state hospitals in the past 2 weeks. So they do keep coming, and that's good news. But with COVID-19, it's a new norm for everybody. Does this affect nursing mothers? What should they be doing differently at this time, if anything at all?
Okay, the peculiarity with newborns is actually because their immune system is usually not well developed, and their systems are still very young. So the mothers have to take extra precautions in taking care of them. Now, what are you supposed to do as a nursing mother? First and foremost, actually have a WhatsApp class where I train mothers, I guide them on what to do with their newborns. But aside from that, make sure you minimize your daughter or your child's exposure to the virus. How are you going to do this? Please, this is not the time for you to start bringing your mother-in-laws or your relatives around the house. Remember, the older ones are even worse off in the susceptibility to the coronavirus. So please leave them at home. Minimize your baby's exposure to it. Stay at home. Anybody that is going to come and go from your house has to actually take precautions. Please let them wash their hands. Let them use the hand sanitizer. If your husband doesn't stay at home, probably he's still working at this time, maybe he's among the essential workers. Whenever he comes back from the office, let him take a bath before he touches the baby. And please, aside from all these that I've mentioned, hygiene. Personal hygiene in your house is very, very, very paramount. All those parts of your houses that comes in contact with people, especially the doorknob of your house, please sterilize them, clean them, sanitize them. It's very important. The car keys, your phones, all those things that come in contact with germs, make sure you sterilize it and you sanitize them. It's very important. If you have older kids in the house, make sure you clean their toys. Teach them how to wash their hands. The school started teaching before the Lagos State closed up the school. They started teaching them how to wash their hands. Even while you are home, teach the older children how to wash their hands properly. And you as a mother, make sure you actually maintain the cleanliness. Before you breastfeed, before you do anything, try as much as you can to clean your hands and wash your hands. Aside from all this, breastfeeding is very important. Remember that your breast milk is very nutritious. It's filled with the antiviral properties, antibacterial properties, antifungal properties. All those things are what your baby needs at this particular point in time. This is not even the time for you to start using formula. Remember, you are not even supposed to go out, because as you go out, you expose yourself to the virus, which means you can actually bring it to the house. I remember that in Wuhan, most of the children that had the virus contacted it from a relative in the family. So please try as much as you can to guide yourself against all this. Even if you need anything at all, this is not the time for your friends to come around. They can actually help you. What would they do? do for you? Let them get the groceries or something that you need and drop it in front of your gate or in front of your doorstep, and you come and get it, clean them, wash them, and sterilize them before you use them. Breastfeed your baby. Your baby needs the breast milk at this point in time so that they can be able to build up immune system to be able to ward up the virus. It is very, very, very important. Aside from those 3 steps, WHO told us that we should incorporate vitamin D into our babies' routines. Please, let's be giving our babies vitamin D. It's actually because we as blacks don't absorb the vitamin D that comes from the sun very well because of our skin. So we started giving our babies vitamin D. In my facility, what we do is actually to give them multivitamin that contains vitamin D. Then aside from the bone maturation and everything, vitamin D has also been known as an immune booster. It helps to boost immune system. So if you are giving your baby vitamin D at this particular point, it will help to also boost their immune system and help them to ward up the virus. Then lastly, please know the signs and symptoms. Get all the information, the right information you are supposed to get concerning coronavirus. Please don't get your information from WhatsApp because most of what you get from WhatsApp are all those things people send, even what our mothers and our fathers used to send, our father-in-law used to send to us. Please get your information from authentic sources. Get information from WHO sites. In fact, they actually have their numbers right now that when you just send a hi to their WhatsApp number, they send you all the information you're supposed to know. Okay.
Real quickly, thank you so much for that. And I'm really excited you did make mention of colostrum, the importance of colostrum. That's the first milk a mother gives to the child. Really, very important stuff. I want to talk about teething babies at this point in time, during all of this pandemic. It's a lot of pain for the child teething. That process is quite Herculean, let alone teething in this time with all the coronavirus and everything. How can nursing mothers not mistake, the symptoms of teething that comes with a fever sometimes with the symptoms of probably coronavirus?
Okay. Symptoms that comes with teething. Teething doesn't cause any systemic manifestation. That is the problem we have with teething. That's why most times when mothers see anything, they will just say, oh, the baby is teething, or maybe the baby is stooling, the baby is vomiting, or the baby has fever. They will say, the baby is teething. Please, teething doesn't cause any systemic manifestation. Now, the only thing that you can get in teething is actually a mild fever, and it's not always. What is a mild fever? A mild fever is a temperature of 37.5 to 38 degrees centigrade. That is mild fever. Please, and most times you just give a paracetamol and it stops. All the other things associated with it, it's not caused by teething. Cough and catarrh, all those ones that they said is part of coronavirus symptoms, the babies are not supposed to have it. What happens in teething is that when they start eating, they start looking for something to itch their gums because their gums are itching them. And in that process, they introduce infections into their system, which can manifest as vomiting, it can manifest as stooling, it can actually manifest as cough and catarrh. Please, it is not the teething per se that causes all these signs and symptoms. It's infections.
Okay, let's take it a step further to talk about, healthcare officials that come in close contact with mothers that have just put to birth. I mean, those first 2-3 days where they are in recovery and before they have to go home and begin to nurse their babies are very important as well. Is there anything that you could just enlighten us as regard to how these healthcare officials should treat the nursing mothers as well as their babies to make sure that there is no transmission of COVID-19? Okay,
what I would say in this regard is that, let me just use an example because of where I work. Where I work, I actually work in departments. So a doctor that is managing somebody in medicine can manage someone in pediatrics. If someone managing someone in O&G, people that give birth, cannot manage someone in surgery. Do you understand? They actually departmentalize. So when you have doctors that work where they deliver children, or you work in O&G, or you work in pediatrics, most times you don't get in contact with all those other people that may or may not carry the virus. But you as a healthcare worker, what can you do? Please observe what observe the necessary precautions. Make sure you sterilize your hands, you wash your hands, sterilize your equipment. It's very, very, very important at this particular time. Use your masks, it's very important. And there's something else I want to emphasize. I think any case that comes in right now, let's just treat them as corona until proven otherwise. Because there's been some cases that probably the person comes in with maybe stooling or vomiting, and there was even a study that they did. They realized that some of the people that started manifesting the cough and catarrh weeks before then, they started having some gastrointestinal symptoms such as vomiting, such as stooling. So when you have it at the back of your mind that any case that comes in might actually be coming with corona, you guide yourself. You actually put on your PPE. Although I know that this protective equipment cannot be actually shared to everybody, but at least wear your gloves. At least wear your masks. Treat everybody as potential coronavirus patients until proven otherwise. If you are handling these babies, please don't use the gloves you use for the other mother to treat this. I know most hospitals don't have enough equipment. In fact, there are some times that you yourself as a medical doctor, you carry your own gloves. Please, if possible, take your own gloves along with you, and so that I can be able to maintain this hygiene they are talking about. Because if you don't do all these necessary precautions, if you don't take all the necessary precautions, the tendency that you transfer infections or coronavirus from somebody that don't have it to someone that has it is very, very, very high. So maintaining these precautions is necessary.
Okay, Dr. Ogundele, I'd like to continue in that line of question because the CDC in the U.S. 2 weeks ago released new guidelines concerning nursing mothers and pregnant women. And they say that pregnant women should give birth alone, basically limiting the amount of people going into labor room with them, just the pregnant women and the medical personnel from the hospital. And they're also saying that if the mothers then show symptoms for coronavirus, they should be separated from their newborns. I wonder if this is a guideline we should also be considering in Nigeria, and what are the implications of this? But we'll go on a break, and then you will come to respond to that question. Stay with us, Dr. Ogundele, as well as our viewers. We'll be right back. Welcome back to the Morning Show here on the Rise News. We still have with us Dr. Uchechi Ogundele, a U.S.-trained pediatric nutritionist and author of A Mother's Guide to Understanding Her Newborn. Thank you, Dr. Ogundele, for staying with us. I asked you that question before the break. The new guidelines by the CDC in America, mothers should prepare to give birth alone, limiting the numbers of people that go into the labor room. And if they do show symptoms, they should be separated temporarily from the newborn. Is this a guideline Nigeria should be looking at? Is it too extreme? And because with coronavirus, we keep learning every day. Do we know the mode of transmission from mother to newborn yet?
Okay. Coronavirus is still a novel virus. We don't know everything about it yet. So each week that comes out, because of the studies ongoing already, WHO comes out with a new guideline for us to take. So I think Nigeria should actually take up this guideline. It's very, very necessary. Remember, our African culture, what we do when we want to give birth is we carry our mother-in-law, our father-in-law, our auntie-in-law, everybody is in the hospital with us. So I think we should adopt this guideline. It's very important, especially because some people that have coronavirus don't even have symptoms. So what if probably your sister-in-law has the coronavirus and doesn't have symptoms, and you are bringing the sister-in-law, probably sister-in-law is the one going to buy drugs, going to buy this one, and you are taking it, and so the tendency for you to transfer infection to the baby is actually very high. So WHO has said, in fact, most of the studies they've done, you cannot transmit. As of now, I don't know if there's anyone they've done recently, but you can't transmit, a pregnant woman cannot transmit coronavirus to the child. They did a study on the amniotic fluid that the baby stays in, and coronavirus was not found in it. They actually did a study on the breast milk, and coronavirus was not found in the breast milk. Now, as a mother, if you have signs of coronavirus, they will take the baby away from you. Why? Because when you are in contact with the baby definitely will contact the virus. Now, how are you supposed to feed your baby? They say you can express. You can express, and the nurses, I saw a lot of babies in Wuhan where the nurses were the ones feeding them, even the younger ones, the nurses were the ones feeding the baby. So I think we can actually express breast milk, and the nurses will help us feed. If any mother shows signs of coronavirus, I think we should adopt the new guideline that WHO has put up.
I've got two quick questions as regards that. There's a prevalence in Nigeria of delivery being done by traditional birth attendants. What are the guidelines for TBAs? We can't just push them away from society like that in this time of coronavirus. And secondly, what about neonates that have birth defects? People that come into the world and they have a birth child like autism.
Can you come again? I can't hear you clearly.
Okay, so the first one is TBAs. A lot of women are delivered by traditional birth attendants. What should be the guideline for them this season? And secondly, children that were born that have things like autism, Down syndrome, and, all the challenges like that. How should we care for them amidst all of this?
Okay, let me take the question on autism and Down syndrome children. Autistic children don't have any issues with their immune system. When they just have issues with behavioral abnormality, they don't have issues with their immune system. So you can actually take care of them the same way you take care of other kids with with precautions, the same way you handle other normal children. But for Down syndrome comes up with a lot of complications. Complications of the heart, complications of the white blood cell, a lot of things. So when you want to take care of a Down syndrome patient, you have to be extra careful. What are you supposed to do? In fact, all the things I've listed, if it's possible for you to double them, please do. And another thing, have the number of your pediatricians so that if you notice anything, if you actually need any emergency, you can quickly call. Please always call before you go so that they can clear the road for you and make sure you don't come in contact with other patients that may or may not have coronavirus. It's very important. Then for the TBAs, I don't know if we should actually allow them at this season, at this pandemic season. I don't know if it's going to be possible, but I don't think we should actually allow the TBAs to run this season because I don't feel that they can actually take the extra precautions needed for this coronavirus season. But if any woman or probably the traditional birth attendants, if they take the precautions listed by the government, sanitize, make sure you sterilize your equipment, make sure you yourself doesn't have signs or symptoms of coronavirus, sterilize the equipment, take all the extra precautions. Maybe you can actually allow them to. But to me, I don't think TBAs should be operating in this season. Thank you.
Well, studies show that about 70 to 75% of new mothers experience postpartum depression after birth, what people refer to as baby blues. Now, coupled with this COVID-19 lockdown, whereas mothers can't necessarily leave their homes with their children, how do you reckon they deal with this depression? Is there any counseling or psychosocial support that the government or even private institutions should be looking at to make sure that these two... Okay. Okay, I'm going to take the question again. About 50 to 75% of nursing mothers or new mothers show postpartum depression. Now, if you couple this with the COVID-19 lockdown, where mothers can't necessarily leave their homes or socialize, is there any counseling or psychosocial support put in place that should be put in place by the federal government or even private institutions to help beat depression? Okay.
My WhatsApp group is actually there. If you want to know more about my WhatsApp group, go to my Instagram page, Doc Uche Speaks, and just click my bio. You can get all the information you need from there. But aside from that, you can socialize with your friends on social media. In fact, there are doctors on Instagram a couple of weeks back, actually collaborated with a lot of doctors to help Nigerians. So what they do is that they go to either my DM or to DM of any of the doctors that responded that day, and we have psychiatrists with us, we have mental health doctors, we have orthopedics, we have a lot of them, that have showed interest to help Nigerians in this season. So you can actually go to my page, Doc Uche Speaks. Just go to my DM, tell us whatever that is wrong with you. I can actually, if it's not my area of specialty, I can just direct you to somebody, that it's in your area, So, but what I want to say is that, why I teach mothers, when you don't prepare yourself mentally, physically, emotionally, spiritually, during pregnancy, when you give birth, the tendency that you have postpartum blues is very high. Some people will say, what do you mean by preparation, because most times what we prepare for is the labor. They say, supernatural childbirth, you want, that's usually what we prepare for. And also the clothes and all the things that the children are supposed to wear. But prepare yourself emotionally, knowing that you are carrying a human being, you are going to be giving birth to somebody that will take all your time. You have to prepare yourself. You have to prepare yourself mentally, you have to prepare yourself spiritually, physically. It's very important. So that when baby comes out, you already know that, okay, this is what I'm expecting. Aside from what you're preparing, you're also making sure that your husband is aware. The people around you, they are aware that there's a new baby coming into the house. Even if you have other kids, prepare them that you are going to have a brother, you are going to have a sister. Let them know. Preparing the family is of paramount, importance.
Okay, Dr. Ogundele, you're also a nutritionist, so let's talk nutrition. You've mentioned vitamin D for the babies. Let's talk about the mothers. What's the nutrition like for them at this time of COVID, where you probably are limited in choices? What's the nutrition for mothers? And then I want to touch on something you said earlier about separating mothers from their newborns if they do show symptoms and let the nurses feed them. Yeah. What are the consequences for that? Because breastfeeding advocates, always talk about bonding of mothers and newborn. What are the likely consequences of allowing, that bond be broken by COVID-19, having the nurses or someone else feed their babies at this time?
Okay, there is always side effect to everything. That's the truth. It will definitely affect the bonding, because when you are breastfeeding your baby, it tends to increase the bonding between you and your baby. So separating the baby from the mother will actually reduce that bonding drastically. But that is one of the things we have to do. I was watching CNN the other day. A medical doctor was, she was lamenting that the husband took custody of the child. Because she is a doctor and she's exposed to the virus. So the court ruled that the husband should take, the ex-husband should take temporary custody of the child. These are the risks involved. There's always risks in everything. But what we say in medicine is that if the benefit outweighs the risk, then we can do it. So in this case, the benefit outweighs the risk. Please, let's do it to be able to safeguard the child.
And then the second question on nutrition. For the mothers?
I'm a pediatric nutritionist.
Oh, okay. Oh,
okay, but aside from that, for the mothers, I tell them to please eat a balanced diet. Now, the constituent of breast milk is actually fixed, but there's some part of it that you can get from your diet. And when you don't get such from the diet, the baby will not take the maximum from you. And I know most of us would have stocked. Please, I hope you stocked our houses. And even if you're not able to stock your houses, something like vegetables are very important. You can't go around drinking Coke and Fanta and you're saying you are eating healthy, And there are some of the foods that our mothers refuse us from eating, such as plantain, banana, granite. In fact, one woman had to tell me that her mother refused her from eating granite, that it will affect the baby. All those things are healthy, Please, let's try as much as you can to eat healthy. As a nursing mother, you need healthy food so that your baby can be able to take healthy meals from you. In fact, what you take as a mother affects your baby. In fact, it actually affects what your baby ends up taking later on in life. It's very important.
Right, very well said there. I just have this quickly before we wrap things up. At this point in time, what should we be giving as guardians to mothers that have children that like pets? And I say that they might have a small Yorkshire Terrier in the house or a small dog because we heard about the case of a tiger catching coronavirus in the zoo. They said it was through human contact. The jury's still out on that. Careful with pets this season. Is that the way to go?
I think so, because coronavirus is a zoonosis. It means it's gotten from animals, you know. So I think we should be extra careful with our pets, you know, make sure that aside from their normal veterinary treatment, aside from taking their baths, you know, make sure you actually feed them healthy. And please don't expose them to other dogs. Don't expose them to other people. Just keep them in your houses.
Okay.
Very
I'd like
important.
to say a very big thank you to you for that. Thank you so much for coming.